Howdy guys, you are welcome to Dr. Mo's blog. Today I'm going to be discussing prostate, benign prostate enlargement or benign prostate hypertrophy. Now this is a very important topic for all men who are above 45 and for women who have spouses that are 45 and above. I think you better keep your ears peeled for the information you're going to get. First and foremost, prostate disease is so important in males because up to 60% of men between 50 and 60 years will have some degree of prostate disease. Now, by the time you are getting to 70 years, between 80 and 90% of men will have one or more symptoms of prostate disease that may require medication or surgery. Now, what is the prostate gland? The prostate gland is a small gland that is attached to the bottom of the bladder. It is conical in shape. It is an inverted cone, and with the tip that is blunt. We call such cones truncated cones. And the pipe, the flexible, deformable pipe that drains urine from the urinary bladder out into the penis, passes unhindered through this gland. Now, this gland, in fact, looks like the African kola nut in shape and in size. We call it the kola nitida because it has 5 lobes, 3 to 5 lobes, and the African kola nut also has 3 to 5 lobes. So the prostate has 2 lateral lobes, a posterior lobe, an anterior lobe, and a median lobe. Now, as I said, this deformable, flexible pipe or the urethra passes unhindered through the body in between these lobes. And usually, until about the age 40 to 45, nothing happens. But for some reason, which we will discuss later, after the age of 45, the prostate gland begins to enlarge. Now, one of the things about this enlargement is that most of the time, it doesn't enlarge uniformly. So it might, 1 or 2 lobes might enlarge. Okay, 1 or 2 lobes or 3 lobes might enlarge. And because of this uniform enlargement, the gland begins to impinge on the urethra. It may elongate it, it may kink it, it may deform it. And when that happens, or it may even compress it. So when this happens, the flow of urine through this pipe is impeded, and the patient starts to develop symptoms of prostate disease. So what causes what causes the prostate to continue to grow when other organs are usually in decline? Well, the scientists are beginning to think now that usually there's a balance between growth and the death of cells. Now this balance is tightly controlled up until the age of 40-45 years, when the the factors that encourage increase in size and proliferation of prostate cells begin to increase in favor. So the balance begins to favor proliferation rather than death of cells. So the size of the prostate begins to enlarge. So why is this? Well, when we discuss nitric oxide, we say that nitric oxide tends to diminish with age, and also so does testosterone. So what are the likely causes of prostate enlargement? The underlying factor in prostate enlargement is metabolic syndrome resulting in diminished level of nitric oxide. Now, when levels of nitric oxide diminishes, it causes insulin insensitivity, which might cause sympathetic dominance, and this will lead to an increase in the contraction of the soup muscles in the prostate gland, and that will compress the urethra. Another process which metabolic syndrome causes is that it causes generalized inflammation, and this inflammation may stimulate the release of cytokines that might stimulate the proliferation of the prostate gland. Another thing is that metabolic syndrome, where there is accumulation of fat, it is known that androgens are converted in the peripheral tissues to estrogens. So as the month goes on, the level of testosterone is dropping. More of it is getting converted to estradiol. So the ratio of estradiol to testosterone increases. And therefore, with the decrease in level of testosterone, the estradiol, with the increase in the level of estradiol relative to testosterone, it favors the enlargement of the prostate. It's also noticed that with age, after the age of 45, the levels of dihydrotestosterone, which is a metabolite of testosterone, also increases. And this is the locally active metabolite. It's the one that is able to stimulate the glands of the prostate to increase. Now, before I go ahead, I want to tell you that the prostate itself is usually described as a fibromyoglandular gland. Okay, so it has fibrous elements, it has glandular element, and it has smooth muscle elements. So when the fibrous elements increase, the prostate becomes rigid. It may not enlarge so much, but it becomes rigid and compresses the urethra. And this form of prostate disease, in which there isn't much enlargement, is usually referred to as Marion's disease or fibrous prostate. Now, when the glandular elements also, when they increase, they also cause a static compression. But the dynamic compression comes with smooth muscles of the prostate, the myo component of the prostate. Now, when these are usually stimulated by the sympathetic nervous system. And when the sympathetic nervous system is stimulated or is dominant due to the lack of nitric oxide, the dynamic component of the prostate usually contracts and causes prostatic symptoms to develop. Now, what are these symptoms? Recently, they are being called LUTS, lower urinary tract symptoms, and maybe OUPS, upper urinary tract symptoms. Now, the lower urinary tract symptoms, which used to be called prostatism, have two presentations. You have the irritative and you have the obstructive symptoms. Now, the irritative symptoms are usually the first to appear. In the irritative symptom, one of the first symptoms that they may occur is called nocturia, that is increased frequency of urinating in the nights. Now, the more, so the patient might wake up 3, 5, 6, 10 times to go and urinate in the night. And when he goes to urinate, he only passes small volumes of urine. Now, the second, so he doesn't sleep throughout the night. He goes up and down between his bed and the urinal. The second irritative symptom is called urgency. Now, urgency means that you have serious urge to go and urinate, and it feels like if you don't urinate very soon, your bladder is going to burst. There is the level of urgency that it can even result in pain. The pain of urgency is called strangury, where you have severe pain and you rush to the urinal to go and urinate. And when you get there to urinate, you just urinate small volumes of urine. The next stage in these irritative symptoms is called urge incontinence. In this situation, the urgency becomes so severe that some drops of urine will usually have wetted your pants by the time you get to the urinal. Now, the obstructive lower urinary tract symptoms will include what is called hesitancy. Now, in hesitancy, you find out that despite the serious urge to go and urinate, you find out that when you get to the urinal, urine refuses to come for a few seconds, and you have to wait, take a deep breath before the urine starts coming in a trickle. One would expect that with such urgency, the urine will come out fast. But when there is prostate and you have a hesitancy, the urine doesn't come for a few seconds until you relax, take a deep breath before the urine starts coming out. Now, another symptom of obstruction is what we call the feeling of incomplete emptying. Now, because the urethra is compressed, the bladder is unable to eliminate all the urine. So you may have up to about a quarter of the urine volume still remaining in the bladder. So you find out that after seemingly urinating and you are leaving the urinal, you find out that your lower abdomen is still heavy. It's this feeling that there's still some urine in the bladder. And that's because truly there's what we call post-void residual in the bladder. Then as time goes on, you might either develop an acute obstruction or a chronic obstruction. In an acute obstruction, urine suddenly, the ureter suddenly gets blocked and you cannot urinate. And because it is sudden, it is very, very painful. In fact, the patients will come wailing and cursing to be relieved. On the other hand, the more insidious and even more dangerous form of obstruction is what we call the chronic obstruction. In this case, the patient seemingly is passing urine normally. He has frequency in the night, but he doesn't know that urine is accumulating. So in some cases, you find out that the urine may accumulate as much as to the size of a 5-month pregnancy, and the patients feel no pain at all. With time, in these chronic obstructive cases, you begin to have upper urinary tract symptoms like pain in the loins. When you start having pain in the loins, increased frequency of infections of the kidney, you will know that the urine has the back pressured and is now beginning to affect the kidney. So these are the ways that you can tell if a patient has a prostate. Now, what would happen to you when you get to the hospital and you have prostate? It will depend on your presentation. If you present in obstruction, the first thing the surgeon will do is to try to relieve the obstruction by passing a urethral catheter to relieve the obstruction, take off pressure from your bladder, take off pressure from your kidneys. Now, after he has done that, he can now begin to take your history. He will take your history to get this history of what I have said. His history, he would like to rule out other factors, other causes like spinal cord disease and prostate cancer, which may actually be what is wrong with you. You will have to rule all that out. Then he will take your urine sample for culture because the urine is usually infected. Then he will take your blood for PSA, which is prostate-specific antigen. Now, before he does that, he will put his finger in the patient's anus and use the pulp of his finger to feel the prostate. Now, how the prostate feels, if it is smooth, okay, and if there was what is called a median sulcus is present, he knows that it is benign. But when he can feel some bumps or roughness, he begins to suspect that it's cancer. So when the results of this prostate-specific antigen comes, what will be done will depend on the level. Usually, if the level of prostate-specific antigen is above 4, the surgeon, or if it's between 4 and 10, the surgeon may want to do a prostate biopsy for you to rule out prostate cancer. But if it is below 2, some say 2, some say 4, then a prostate biopsy may not be compulsory. Another thing that one needs to know is that prostate-specific antigen varies with age. So there's usually a nomogram that they will use to compare your levels with your age. And if it's normal for your age, there might not be any overwhelming need for a biopsy. After this is done, the doctor might want to do more investigation. He will want to do abdominal ultrasound to confirm the size of the prostate, to find out if the median lobe is enlarged, to find out whether there are other pathologies like stones and other things within the bladder. He might want to do a cystoscopy. A cystoscopy is a special scope that is passed through the penis into the bladder so as to get a pictorial view of the bladder and possibly to take biopsies to rule out other pathologies like bladder cancer and so on. So that he may want to do that. He may also want to do a transrectal ultrasound when he suspects that there is cancer, so that he can do targeted biopsy of places that he suspects where there are bumps. We'll take the biopsy from there. Then he may want to do other investigations depending on the severity and what his suspicion is. Now, quickly, how do you treat prostate? The first way of treating prostate is what is called masterly inactivity. If the symptoms are mild, okay, just frequency and all that, the doctor might say, no need for treatment. Let's monitor you for some time. And people can remain in that state for years without needing any form of treatment. And usually the instruction we give to such people is that don't eat a heavy meal after 6 p.m. Don't drink any water after 6 p.m. Once you do that, you don't take water after 6 p.m. and you don't eat a heavy meal after that, after 6 p.m. You're unlikely to have nocturia, that is frequent urination in the night. Now, if this doesn't work, then you might be forced to give medications. Now, there are several medications. The first type of medication is used to relax the smooth muscle. Yeah? An example of that is tamsulosin. Then the second one is to reduce the growth, to shrink the prostate. And that one you have the finasterides, the dutasteride. So those are drugs that your physician may prescribe for you to help you to overcome the problem. Now, recently too, the FDA has approved Cialis, that is Tadalis, to help to reduce the symptoms of prostate enlargement. And it has been found that people who take Tadalis or Cialis along with the other drugs that I mentioned earlier on may in fact not need surgery most of the time. Now, when medical treatment fails, that's when you need to now go and do surgery. So the surgery might be an open prostatectomy or minimally invasive prostatectomies. That's what you call the TURP, where you have a small knife that you pass through the cystoscope to scrape off the extra prostatic tissue. You can use laser, you can use microwave, you can use high frequency ultrasound. All these can be used to reduce the size of the prostate and prevent open surgery. When all these fail, or where they are not available, then open prostatectomy becomes the last choice of treatment. Thank you very much. Questions are welcomed from via the comment section. Please don't forget to subscribe to this channel, hit the notification bell so that when I do the next video on prostate cancer, you will get to watch it. Thank you very much. Bye for now. See you in the next video.